Hello everyone, my name's Mia Collet from Panoramic Associates. I'm one of the business managers here, and today we are with Steve Maddern as part of the Public Health Spotlight campaign, inspiring the aspiring directors of public health. So if you'd like to start by introducing yourself, Steve, that would be great.
Yeah, my name's Steve Maddern. I'm the Director of Public Health here at Swindon Borough Council.
Okay, amazing, thank you. And can you please give a brief introduction as to your career and your journey to become a Director of Public Health?
Yeah, okay. So my career in public health has spanned probably about 15, 20 years. My career originally began in community pharmacy when I kind of felt that working with people one-to-one really wasn't helping to address some of the wider health needs. So I ended up in a whole variety of roles before thinking about that I was working in a public health space. Throughout my career, I've worked in a variety of organisations, including the NHS, social enterprises. I worked for Public Health England for a little while. And then I've been in local authority for the last 10 years. I'm a non-medic through training, and I've gone through the portfolio route. So that's where I can demonstrate that I can work to consultant level without going through the consultant program, but through additional training and education. Became a consultant in 2017 and then had the pleasure of becoming the Director of Public Health in Swindon in April 2020, so just as the pandemic.
Oh gosh, brilliant. Thank you for that. And what is the role of a Director of Public Health?
So to me, I think it's really what it says on the tin, is that we are here to provide a leadership role around protecting the population of which we're responsible for. So for me, I have a role to improve the health, but also protect the health of the 233,000 people that live here in Swindon.
Wow, okay, brilliant, lovely. And what's it like working as a Director of Public Health in Swindon Borough Council?
It is wonderful. I wouldn't have any other way. It's a great job. Swindon is a really diverse place to live and work. I had the fortune of living and working here. That brings with it both challenges and opportunities. That did provide some issues and challenges during COVID. It can't go without mentioning, can it? But on top of that, we have a really phenomenal response to how we look after public health across Swindon. So I say about Swindon that it's small enough you can wrap your arms around it, but we're complicated enough to make us interesting. So it does absolutely keep us on our toes.
Oh, lovely. And can you elaborate as to what is unique about the Swindon population that brings kind of challenges and opportunities as well in a bit more detail?
Sure. So Swindon is based in the southwest, but we're pretty much as you're exiting. As I've already said, the population is around 233,000. We're continuing to grow, which is a phenomenal thing. But we probably do have one of the most diverse communities, or a range of communities that you don't see typically across the southwest. So roughly around 15% of our population wouldn't identify themselves as being from a white heritage. When you compare ourselves to our neighbours like Gloucestershire and Wiltshire, they're only looking at around about 3%. So again, a really diverse population. I often describe Swindon as a northern town that slid south, because we have very similar characteristics to other local authorities in the Midlands and in the North that aren't very characteristic of the rest of the Southwest.
Brilliant, thank you for that. And if you can cast your mind back, what would you say is one of the most rewarding experiences that you've had so far as a Director of Public Health?
Okay, so I'm 4 years in. And as I've mentioned, I came into the role at the start of the pandemic. It would be amiss to say that responding and recovering from the pandemic hasn't been rewarding, because it really has. I think to pick probably another example would be the Swindon's response to the cost of living crisis. So another opportunity for public health leadership to drive that agenda with multiple partners, multiple agencies, and a whole range of local authority offices to really respond to the cost of living crisis. And that's been rewarding for me, because we've had the opportunity not only to impact positively on the lives of vulnerable residents in Swindon, but also to get recognition in regional and national level to really sell the good practice that we're doing, and also have the opportunity to build upon it.
Yeah, that's great. Congratulations on that. And then on the flip side, what would you say would be kind of one of the most challenging experiences you've had so far as a director, and what have you learned from that more importantly?
Okay. So again, can't say that COVID wasn't challenging. I think, but on a more broader level, looking at the diversity of our populations continues to be a really positive challenge that I like to approach with gusto. And I know that my team do so as well. So if you look at Swindon, we talk about diversity, and that's over 40 languages that we speak.
Wow.
So having to look at how we adapt our public health messaging and support into those communities that wouldn't naturally engage with us is a real challenge. So I think for Swindon, we are seeing issues around childhood obesity and oral health issues, but also vaccine uptake. So for us, things like ensuring your children are vaccinated before they go to school is really important. But having to nuance that based on the communities that we engage with does provide us with challenge.
Yeah. Okay, brilliant. Thank you for that. And what's one thing that you would have wished you would have known before becoming a Director of Public Health?
The one thing I wish I would have known. I think the one thing I would have wished I'd had known would have been do not read comments written about you on social media. And grow a thick skin, I think, is a really key thing for that. So despite being in public health for a number of years, the pandemic really did put directors of public health in the spotlight, probably for the first time in a quite a significant number of years. So as my mum would always say, you can only please some of the people some of the time. But the people that you don't necessarily please are always quick to go to social media. And particularly during COVID, some of those responses were quite challenging. And I think I took them quite to heart early in the pandemic, but the skin grew thicker as the pandemic went on.
God, okay. No, thank you for sharing that. And the next question is, what do you think are the biggest future priorities within public health, specifically across Swindon, but also nationally as well?
Yeah, so I think it's almost kind of three ply. So we've got our kind of communicable diseases, so the diseases that we pass on to each other. That's always the challenge for us. And I think for Swindon in particular, because of the diversity of our population, ensuring that those vaccine preventable diseases are managed and that we increase vaccine uptake is really important. We can see in the media at the moment that there are challenges around measles and whooping cough. Yeah. Not necessarily an issue for Swindon, but could be given our proximity to the Midlands and to London, where we're seeing outbreaks at the moment. From a non-communicable disease perspective, sometimes called lifestyle diseases. So obesity is a real challenge for us, particularly in children, as is oral health. So we need to focus on how we look to reduce that for the current generation and the future generations going forward. And I think the other priority for public health really has to be around what we're calling the commercial determinants of health. So this is how the environment influences the choices that we make. So for Swindon, there's a real focus on how do we change the environment to help people make healthy choices. And one of the key things we want to do in that space, it's really around things like fast food advertising and how we restrict that so it helps people to not have to make difficult choices when it comes to food, for example.
Okay. Now let's talk about interviews. What tips would you have for aspiring directors of public health on how to prepare for their director of public health interviews?
Yeah, so I think there's a number of tips. So I think the first thing is make sure you definitely want the job. I think panels very much can sense if you are hungry for the role or not. Make sure you read all the key documents and make sure you understand them. So Joint Strategic Needs Assessment, Health and Wellbeing Board strategy, and also the council plan if the role is in a council are the three key documents. But make sure you read broad and wide and make sure you understand where you want to work and why you want to work there is key. Breathing is always really important. If you do get an interview, make sure you breathe because so many people don't use it for thinking time, but make sure you breathe. One thing I would always recommend is once you know who the panel is, reach out to those panel members and you just ask for an informal catch-up, half an hour. Some people will accept, some might not. It may feel quite strange to some panel members, particularly if it's multiple agency, for candidates to reach out in that way. But if they are willing to have a conversation with you, it gives you an opportunity to get them to start to know you before their interview, but also you can learn what their priorities are and how what you want to do can dovetail with that. So I think that's a really good tip.
Yeah.
And I think the last tip that I would suggest is just make sure when you're going in and you're answering questions that you use a framework. So one that we tend to use quite often in the public health world is STAR, STAR. So understand the situation, the task, the action, and the result.
Yeah.
Don't dwell too much on the situation and the task, but really much focus on what did you do in that space and what was the result. And if the result wasn't great, that's okay. What did you learn from it? And how did you then apply it to your broader practice? So I think those are my key tips for people that are applying for and potentially getting interviews for director roles.
Well, those are really, really good tips. And I think people often, especially in the public health world where they're so modest, use the word we rather than me or I. What did I do? So recognizing what you did in the result is really important. So great advice.
You're very much trying to demonstrate in that panel that you are a modern public health leader.
Yeah.
And it does go against the grain because in public health we are very much we than I. But what the panel will want to see is specifically what did you do?
Yeah.
How did you do it? And even if others delivered on it, that's fine. But what the leadership and what space did you create to allow other people to thrive?
Yeah. Okay, great. Thank you. And then the next question is, what is the one final piece of advice that you have for aspiring directors of public health?
So I think I don't have one. I've probably got about 3. So I'll try and keep them. I'll try and keep them safe. I appreciate that people don't always necessarily know if they want to be directors of public health. I think some people know they do and will get there, and some people aren't so sure. Do look at some of the leadership programs that are open to aspiring directors. So there is an aspiring directors of public health program, which just allows you to check in a safe space with other like-minded people whether a future career as a director of public health is right for you or not. I think for some people it is the right thing, but it isn't for everyone.
Yeah.
And it's being very mindful of that. I suppose my other advice in that space is always be kind to yourself. So always put your own life jacket on first. And I would say my ultimate piece of advice is do not let fun be the enemy of work.
I love that. Thank you. And then my next question is, why did you choose Swindon Borough Council to become a director of public health?
Yeah, it's a great question. So as I've mentioned, I've been in public health 15, 20 years now, and I've progressed into a director's space. I had the pleasure of being a resident of Swindon prior to working for it, so I recognise the wonderful diversity of Swindon, and I really wanted to contribute to the health and well-being. Okay. So I felt that I had the skills to bring here. As I've mentioned, the town is small, but it's complex, which makes it exciting. It's a real challenge from a public health perspective to improve health and keep people safe. Yeah. And from my point of view, I felt that I have a lot to contribute into that space to be able to live and work within the same communities, which is really great.
Oh, wonderful. Thank you ever so much, Steve. It's been really insightful and I've learned a lot myself, and I'm sure the listeners would have done as well. So thank you very much.